Hello, and welcome to Basic Spanish for OT, PT, and SLP. My name is Juanita, and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. Before we get started, let's do a few things, I should say. One, if you have an opportunity, please just like the video. This is for my benefit, so I know if people are liking the video or not. I hope you do. Two, subscribe if you would like to get more content or you'd like to be notified when these videos or these series of videos are being uploaded. And thirdly, tell other clinicians. It can be therapy clinicians or healthcare practitioners. It would be helpful to them. Today, we will focus on basic functional Spanish greetings that can be used. As a reminder, these series of videos, as well as the ebook and the book, are not meant to be exhaustive, and they're not meant to avoid using a certified medical interpreter. So I would encourage you to make sure you have an interpreter. But it is designed to be a therapy tool in the clinician's toolkit to help them when working with clients that may have difficulty understanding English. With that being said, vamos a empezar. So, we're going to start with the real basics. Some of you may already know this. So, for instance, when you want to say hello, you walk into a patient's room, you walk into a patient's or a client's home, the first thing we usually say is hello. So, hello in Spanish is hola, hola, hola. Another term that sometimes, especially in the region where I'm at, sometimes we do hear the term bueno. Bueno, bueno, bueno. So, there you have it. You say hello, hola, or bueno. The next thing usually we would do when we walk into a person's presence is to greet them according to the time of day in which we're at. So if it's the morning, you want to say buenos días, buenos días, buenos días. And that usually would be from anytime early in the morning until noon, until 12 o'clock noon, okay? If you're going from 12 o'clock noon until dark, usually, so maybe around 5 o'clock, depending upon what part of the region you're in or where you're at, it depends, or usually up until the time it's dark. Once it's dark, then we go to the afternoon, to the evening. But to start for the afternoon, it would be buenas tardes, buenas tardes, buenas tardes. Okay? And then if you're doing the evening or the nighttime, it would be buenas noches, buenas noches, buenas noches. For most therapy clinicians, we won't be using buenas noches that much because for the most part, therapy is usually doing in the morning or the afternoon. If you're in a clinic, possibly you may use the buenas noches if you have nighttime therapy sessions. So let's put all of that together. You're walking into a patient's presence, and the first thing that you want to be able to say is hello, good morning, or hello, good afternoon, or hello, good evening. That would be hola, buenos días, or hola, buenas tardes, or hola, buenas noches. Again, you can use bueno, buenos días. Bueno, buenos tardes. Bueno, buenas noches. And that is how you would do basic greetings in Spanish. I said this before in some previous videos that I'm trying to keep the videos relatively short, so this way you would have an opportunity to review them, listen and review. I know people's time is precious. I know my time is precious, but this will allow you to be able to look at it in under, I think I'm approaching the 5-minute mark. So thank you for this. Gracias. Adios.